Chapter 19, Implementing Nursing Care. Implementation is the fourth step of the nursing process, and it begins after the nurse develops the patient's plan of care. This will involve the performance of nursing and collaborative interventions that are needed to achieve the goals and the expected outcomes. A nursing intervention is any treatment that is based on a clinical judgment and knowledge that a nurse performs to enhance patient goals or outcomes. Nursing interventions will include direct and indirect care measures, which are either nurse-initiated or physician-initiated. Ideally, the nurse should choose interventions that are evidence-based, providing the most current and scientifically supported approach for delivering patient care. The American Nurses Association describes what a nurse is licensed to perform. Nursing is the protection, promotion, and optimization of health and abilities, prevention of illness and injury, facilitation of healing, alleviation of suffering through the diagnosis and treatment of human response, and the advocacy in the care of individuals, families, groups, communities, and populations. This is the nursing interventions scope of practice. So you can see how the interventions are broken off into direct care, which is laying hands on, and indirect care, which is doing on behalf of the patient. These can be either nurse-initiated, provider-initiated, or other provider-initiated. Throughout this case study, there will be examples of implementing nursing care with respect to this patient's case. The creation of standard interventions is supported in health information documentation systems. Use of standard interventions helps capture patient care information that can be stored across disciplines and care settings, making it easier to measure the quality of care delivered, and it also supports ongoing research and analysis. Nurse and health provider initiated interventions include clinical practice guidelines and protocols, care bundles, standing orders, nursing interventions classifications, and standards of practice. A clinical practice guideline or a protocol. This is a systematically developed set of statements about appropriate health care for specific problems or clinical situations. A care bundle is actually a group of interventions related to a disease process or condition. The interventions, when implemented together, result in better patient outcomes than when they are implemented individually. Care bundles improve quality of care while preventing the most common complications associated with conditions or diagnoses. A standing order is a pre-printed document containing medical orders for routine therapies, monitoring guidelines, or other diagnostic procedures for patients that have identified clinical problems. A standing order directs patient care in a specific clinical setting. The NIC system differentiates nursing practice from that of other healthcare disciplines because it offers a language that nurses can use to identify treatments that nurses perform. It can organize this information into an understandable structure and provide language to communicate with patients, families, and all healthcare providers. Nurses use the ANA standards of professional nursing practice as evidence of the standard of care that's provided to the patients. The standards are formally reviewed on a regular basis. The newest standards include competencies for establishing professional and caring relationships, using evidence-based interventions and technologies, providing ethical, holistic care across the lifespan to diverse groups, and using community resources and systems. The standards emphasize implementing a timely plan following patient safety goals. The Quality for Safety in Nursing, the QSEN Institute, established standard competencies and knowledge, skills, and attitudes for the preparation of future nurses. The goal of the QSEN is to prepare nurses so that they can continuously improve the quality and safety of the healthcare system. The critical thinking model is a framework for how to make decisions when implementing nursing care. The nurse learns how to implement nursing care by applying appropriate knowledge, experience, attitudes, and standards of care. Delivering nursing interventions can be complex. It is based on knowledge the nurse has about the patient and the social context of the healthcare setting. Exercising critical judgment and decision making while delivering delivering each intervention means that the nurse needs to think before they act. The nurse will consider the resources they have and the scheduling of activities within the healthcare setting. This will often influence when and how an intervention is completed. The nurse is responsible for having the necessary knowledge and clinical competence to provide safe and effective interventions for their patients. Preparing for implementation ensures more efficient, safe, and effective nursing care. As nurses, we should perform 5 prep activities. We should always reassess the patient, review and revise the existing care plan, organize the resources and the care delivery, anticipate and prevent complications, and implement nursing interventions. Assessment for a nurse is a continuous process that occurs each time the nurse interacts with the patient, and it always involves the collection of new data. The ability to manage patient care in a timely way conveys a caring and concern to the patients. Poor patient care results when the nurse is hurried, experiences interruptions, or they are disorganized. Time devoted to nursing care has 3 components. Physical, which is the actual amount of time that is necessary to complete the activity. Psychological, which is what nursing care patients experience and how they experience it. And sociological, the sequential order of the events within the daily routines. Risks to patients will come from both illnesses and treatments. The nurse will observe for and recognize risks, adapt the choice of interventions to each situation, assess the relative benefit of the intervention versus the risk, and take risk prevention measures. Many conditions will place patients at risk for complications. As a nurse, they are often the first ones to detect and document changes within a patient's condition. The nursing practice requires cognitive, interpersonal, and psychomotor skills to implement direct and indirect nursing interventions. The nurse is responsible for knowing when one type of implementation skill is preferred over another, and for having the necessary knowledge and skill to perform each intervention. Cognitive skills include critical thinking and decision making, like problem solving and clinical decision making. Interpersonal skills are essential for effective nursing interventions. Applying interpersonal communication skills by developing a trusting relationship, expressing caring, empathy, and communicating clearly with patients and their loved ones. Psychomotor skills require the integration of cognitive and motor activities. Nurse-initiated interventions are determined by state nurse practice acts, supervised by the entire healthcare team, made in concert with the plan of care initiated by the physician, developed after interventions for the recent medical diagnoses are evaluated. The answer is A. Individual nurse state practice acts determine nurse-initiated interventions. A clinical practice guideline is a collection of institutional policies that assist nurses, physicians, and other healthcare providers in making decisions about appropriate healthcare for specific clinical situations, such as the management of tuberculosis. True or false? The answer is false. A clinical practice guideline or protocol is a systematically developed set of statements that will assist the nurse or physician in making decisions about appropriate healthcare for specific clinical situations. Nurses provide a wide variety of direct care treatments and procedures that are performed through interaction with patients that involve the laying on of hands. How the nurse applies the implementation skills will affect the success of any direct care activity. The nurse needs to remain sensitive to the patient's clinical condition, previous experience, their expectations, as well as their cultural views. All of our direct care measures require competent, safe practice. When a nurse shows a caring approach each time they provide direct care, they are building on the nurse-patient relationship and building trust. Counseling is a direct care method that helps patients use problem-solving processes to recognize and manage their stress and facilitate interpersonal relationships. As a nurse, you may counsel patients to accept actual or impending changes resulting from stress. Patient education is key to patient-centered care. A teaching plan is necessary for every patient, especially when patients need to manage health problems they are facing for the first time. Counseling and teaching closely align because both involve good interpersonal skills to create a change in the patient's knowledge and behavior. Counseling results in changes in the development of new attitudes, behaviors, and feelings, where teaching focuses on intellectual growth or acquisition of new psychomotor skills. An adverse reaction is a harmful or unattended effect of a medication, test, or an intervention. Adverse reactions can result from any nursing intervention. Therefore, the nurse needs to learn to anticipate and know which adverse reactions to expect. Nursing actions that control for adverse reactions will reduce or counteract a reaction. Preventive nursing interventions promote health and prevent illness to avoid the need for acute or rehab care. Changes in the healthcare system are leading to a larger emphasis on promotion and illness prevention. Primary prevention is aimed at health promotion that includes health education, immunizations, and physical as well as nutritional fitness activities. Secondary prevention, this focuses on individuals who are experiencing health problems or illnesses and who may be at risk for developing complications or worsening condition. It can include screening techniques or treating early stages of a disease process. Tertiary prevention includes minimizing the effects of long-term illness or disability, including rehabilitation. A pre-printed document that contains orders for the conduct of routine therapies such as oxygen therapy is referred to as a. The answer is standing order. A standing order is actually a pre-printed document that will contain orders for the conduct of routine therapies, monitoring guidelines, or diagnostic procedures for specific patients with identified clinical problems. An example would be the registered nurse has the assessment skills and knowledge to understand the patient's oxygen level should not be any less than 90%. If the patient's oxygen level is less than 90%, the nurse has a standing order to place nasal cannula with 2 liters of oxygen and then call the doctor for further treatment. You are writing a care plan for a newly admitted patient. Which of these outcome statements is correctly written? The patient will eat 80% of all meals. The nursing assistant will set the patient up for a bath every day. The patient will have improved airway clearance by June 5. The patient will identify the need to increase dietary intake of fiber by June 5. The answer is D. Outcome statements should have measurable and realistic goals. In this case, the goal is both measurable, which identifies the need to increase dietary intake by June 5, and realistic. Indirect care measures are nursing treatments or procedures that are performed on behalf of the patient but away from the patient. Nurses spend much time using indirect care management activities. Communicating information about patients is critical, ensuring that direct care activities are planned, coordinated, and performed with proper resources. Delegation of cares to unlicensed assistive personnel is another indirect care activity. When performed correctly, delegation ensures that the right care provider performs the right task so that the nurse and the assisted personnel work together more effectively for the patient's benefit. Effective communication and good teamwork will reduce medical errors and prevent adverse patient outcomes. Miscommunication is often the root cause for most reported adverse or sentinel events that occur in a healthcare organization. Isolation precautions as a treatment intervention are an example of which type of care? Direct, indirect, prevention, or safety? The answer is B. Indirect care interventions are treatments performed away from the patient but on behalf of the patient. Implementing isolation precautions is an example of providing indirect care by managing the patient's healthcare environment. Nurses implement interventions to achieve patient goals and expected outcomes. In most clinical situations, many interventions are needed to achieve the selected outcomes. Patients' conditions can change minute by minute. Therefore, it is important for the nurse to apply principles of care coordination using good time management, organization, and appropriate use of resources to help deliver interventions effectively and meet the desired outcomes. Priority setting is critical in successful implementation. Priorities will assist the nurse to anticipate and sequence nursing interventions when a patient has multiple nursing diagnoses and collaborative problems.